Now, class, we are on to the elbow. The elbow is typically a 3-view series, AP, an external oblique for the radial head, and a lateral. So I'll show you what those look like. It's pretty easy. So, Jill, if I could, I'm gonna have you just stick your hand straight out, palm up, and lean in this way a little. Raise your arm straight up for me, just like that. I'm gonna move the table. Raise your arm up slightly. That way I can get in here a little better. And then lean way forward, way forward. So you wanna get the shoulder and the wrist and as close to the same plane as possible. Then I want to center mid joint to the elbow, like so. Alright, just like that. And then I mark laterally, so that is the thumb side again. Just like that. Maybe. Alright. I'm going to angle my cassette slightly, just to make it a little prettier. Like that. Make sure when you put your marker on that you do not place it under the shadow of the soft tissue. That would be a problem. Center approximately there for my elbow. All right, hold real still. Beep. That's going to be my AP elbow. Now we're going to go to the oblique. For the oblique elbow, you're looking to try to remove the radial head from superimposition. To do that's a little tricky. You have to externally rotate very far. And it's uncomfortable. Like Jill was just uncomfortable in the position I had her in. It's gonna get a little more uncomfortable. So I'll have you kind of lean forward again, if you would, for me. And what I need you to do is roll your body way out that way. Way out there. Yeah, now raise your arm up. Just like that. Yep, set down. And then I'll just make the adjustment. And on this one, I just wanna be quick, right? So I get them there as far as I can. When they're as far as they can go, I usually say, okay, go a little bit more, just like that. Hold real still, hold still, beep. And it's over, go and relax. So it's a quick move. I mean, when they're hurting, that's real important. When you do that view on a pediatric patient, it's probably going to reduce the radial head, because if they had nursemaid's elbow and the radial head was dislocated, that's gonna put it back in. So that's not a lot of fun because they're screaming, they're hurting, but you'll probably end up in that situation. All right, so the last one here is going to be the lateral elbow. Okay, ma'am, so see my arm like this? Just do it just like that, thumb up, raise your arm up. I'm gonna move this in and raise up one more time, move it over, and then lean way in this way, way in. Okay, go ahead and relax. I'm gonna try something a little bit different. So I noticed that she was having a hard time getting her shoulder and elbow on the same plane, so I'll build the film up. Raise up real quick, I'm gonna move some stuff around. I like these Kleenex boxes, they're pretty good, nice and steady in the middle here. Go ahead and set your arm down. And you see, that puts the shoulder and the elbow in the same plane, and sometimes that's a little easier for the patient. So then I want to maintain my SID though, so my magnification is the same. So I'm at 40 inches again, center to mid elbow, make sure she's perfectly 90 degrees, thumb up, there we go, center right to the elbow, and I like to mark this anterior there. That's where I mark for my elbows, hold real still, beep. Perfect.